It's not an easy road. You get up every morning and you're like, why?
Well, this Johannesburg woman speaks to the SABC on condition of anonymity. It's an onerous duty, one thrust upon her by the fickle hand of fate. So she's taken over the parenting responsibilities of her two nieces, aged 10 and 13. Their father succumbed to COVID-19 complications, and in the ensuing months, it's been an uphill struggle to nurture and protect the children and provide for their needs.
It's just been one rocky road as far as them coming to terms with the death, coming to terms with moving to a new school, coming to terms with moving into a new household almost, coming to terms with things being different, schooling being different, emotional being different. And as a result, we've had hassles trying to get them almost put into the schooling system and get them reacquainted with the new school as opposed to the old school, because their lifestyle was different, everything was different, and now they need to deal with grief, deal with school, deal with new friends, peer pressure, deal.
The Teddy Bear Clinic says its research shows the home structure has been torpedoed by the pandemic, with 1 in 20 households having suffered a loss or losses.
This has certainly affected children's behavior. Some of them have been displaying behavioral disorders, acting out, aggression, sometimes just withdrawn, introverted behavior. And as I mentioned previously, lack and loss of interest in activities that they participated in. So in just a broad outline that at least 1 in 20 households have suffered due to this pandemic and the losses of loved ones.
Social Development says it was not caught unaware when the pandemic struck 2 years ago. So it says there were already systems in place to care for the most vulnerable due to the prevailing HIV/AIDS pandemic.
We have programs like Risiha. Risiha is a program whereby we have child and youth care workers. They go to communities and they find these children who are vulnerable, whether they are living with their grandparents and whether they are living alone. And we also had to make provision for child and youth care centers. These are centers where children, when they choose not to stay together and they have no other relative to look after them, they can come and stay into an institution and a state-run institution. Then we also had the issues of child support grant, foster child grant. We have adoptions. We have all this basket of services that when children are in need of care and protection, they are able to be integrated within families and communities.
The African Centre for Disease Control and Prevention says COVID-19 has had a devastating effect on the social structure on the continent.
The effect is that the family and the social structure is disrupted. Heads of families are dying, leaving behind young children, leaving behind families that need to be taken care of. People with comorbidities are suffering even more because on top of the diseases they have to take care of, they also have to take care of COVID because they did not get enough vaccines on time. So the social fabric is disrupted. The healthcare seeking habits are disrupted. The healthcare systems itself is stretched. And Africa has had to suffer.
While the pandemic swept across the land, leaving death and destruction in its wake and decimating family structures. An untold number have been orphaned, and it will take the committed will of government and broader society to ensure these children don't become Oliver Twists, begging for a bowl of porridge. Chriselda, SABC News in Johannesburg.